Giftship is a health insurance that is taken up and paid for by groups, individuals and families not covered by other NHIS coverage platforms. The president of the association, Barrister Olumide Apata, SAN, with a team from the NBA were at the corporate headquarters of the NHIS in Abuja to formalize the enrollment of 1,000 of its members into the NHIS. This is coming 7 months after talks were initiated. In his remarks, Barrister Apata said it is essential and critical for all Nigerians to subscribe to the National Health Insurance Scheme because of its importance.
A healthy population is what will bring about a productive economy. There's no doubt about it. And we are trying to leapfrog our economy. So I undertook to ensure that at the level of the NBA, we will sensitize our own members and let them understand why it is important to subscribe to health insurance.
Olumide Apata went on to explain that lawyers are trailblazers. As such, the community looks up to them for guidance on a lot of issues, and health is one issue the association intends to propagate continuously.
Our game plan or our strategy was to encourage our members by, as an association, paying for 1 year subscription for 1,000 of our members. That was our strategy, and I came to let you know. I'm delighted to inform you that we have done now. We caused to be transferred to your account in the central bank 15 million naira for 1,000 of our members, which I have a list here of the 1,000 members who we are hoping you can onboard into the scheme, the Giftship scheme, as soon as practicable.
The Executive Secretary of the NHIS, Professor Muhammad Sambo, in his response, described the MOU with the NBA as a landmark achievement for the NHIS, which has been campaigning for more Nigerians to register with the health scheme.
If we launch this program and we have lawyers coming in, who will not come in? Nobody. Today we say that the lawyers of Nigerians have recognized NHIS as a viable organization, and they come up with 1,000 people to join a newly launched program of NHIS. This is a story for the national insurance.
Professor Sambo added that development of the Giftship insurance platform was meant to give everyone an opportunity to join the health insurance scheme, irrespective of where they work.
The Giftship program that we are coming today is a platform whereby self-employed associations, our people in diaspora can subscribe into it. And the more we have the number, it's an insurance. Insurance rests on number. The more you have the number, the more you have the fund, and the more you have ability to do a cross-subsidization. And with your coming, we believe that many people are already coming into the Giftship program. And with your coming today, we believe that it will open a new horizon, whereby we will now begin to see people coming into the national health insurance en masse.
The event later saw the signing of the Memorandum of Understanding between both parties, after which the NBA presented a check of 15 million naira to the Executive Secretary of the NHIS, Professor Muhammad Sambo, to formally register 1,000 of its members. The Nigerian Health Commissioners Forum has scaled up its collaborative efforts in a bid to strategically reposition the country's health sector and explore potentials for improving healthcare service delivery across Nigeria. The forum, at its two-day quarterly meeting held in Abuja, tagged Building a Stronger Health Sector in Nigeria through collaboration and strategic partnership, acknowledged that Nigeria's health sector requires a revolution to rebuild the sector, especially in the fight against COVID-19.
One of the very striking issues.
Speaking during the opening ceremony, the chairman of the forum, Dr. Betta Edu, noted that the purpose of the quarterly meeting was to rally all health commissioners from the 36 states of the Federation to come up with policies, decisions and networks through a joint communique that will state the forum's position on how Nigeria can achieve universal health coverage, UHC, as well as how they can improve preventive care at state levels, as well as solicit robust support to fight COVID-19 and other issues.
We're looking at building a stronger, more resilient health system in Nigeria that can indeed respond to any pandemic or any epidemic that would break out. We're looking at a system that should efficiently offer quality healthcare services with access, equity as the watchword for all Nigerians. And as we come for this meeting, permit me to do a bit of ground setting. We're just simply here to discuss the way forward for the health sectors at the state level.
We have been able to respond appropriately.
In his goodwill message, the Executive Secretary of the NHIS, Professor Mohammed Sambo, emphasized the importance of collaboration and partnership in the drive towards an effective healthcare delivery system.
Collaboration and strategic partnership is very, very critical to the attainment of the goals of the health sector, especially in a country where a federalism health system is being implemented with 3 tiers, with involvement of many partners and donors. Health sector wouldn't have worked if there is no effective collaboration. So the theme of this meeting is very apt for the healthcare delivery system, and for the healthcare delivery system to be able to respond to the high infant mortality, high maternal mortality, and other high indices that is bedeviling the country.
Professor Sambo then reiterated the commitment of the NHIS to support the commissioners in their quest to achieve the desired healthcare delivery system.
The program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Scheme. The workforce of an organization determines the effect of its service delivery. As such, the workforce in the health system and healthcare organizations determines health outputs and outcomes and drives performance. One of the critical challenges faced by the NHIS is the inadequate number of doctors and other medical professionals. That, in effect, has affected the capacity of the scheme. What is the exact situation on ground? What did the Executive Secretary do? These, amongst other questions, are answered in our next segment, Issues Around the NHIS. Keep watching.
The National Health Insurance Scheme, NHIS, came into existence in 2004. The agency, which is under the Federal Ministry of Health, was established under the NHIS Act and is designed to provide easy and affordable access to healthcare for all Nigerians. The scheme has achieved over 90% coverage of federal government employees, while state, formal and informal sectors have started to show remarkable interest in joining the scheme. The NHIS does not provide health services but interrelates with stakeholders, including the healthcare providers, at different levels through which enrollees can access service. Available reports indicate that there is inadequate human resource requirement to enable NHIS discharge its mandate and responsibilities. This is largely responsible for its weak performance and resultant deficiencies in work values, attitudes and practices over the years.
In terms of human resource, out of 1,400 staff, only 40-something are health workers. The number of people that read history in NHIS are more than the number of healthcare professionals combined. And if you look at the business process of the National Health Insurance Scheme, you see there is what is called accreditation, where you go and accredit healthcare facilities and accredit health maintenance organizations. If you are not a professional, you cannot do an effective accreditation. There is issue of quality assurance, where interrogation is done as to what has happened to the patient. If you are not a healthcare professional, you cannot do it. There is issue that has to do with reconciliation. If you are not a professional, you cannot do it.
Consequently, the new management under the leadership of Professor Muhammad Nasir Sambu thought it necessary to strengthen policy, planning and management of human resources for the attainment of NHIS's organizational mandate.
So we now set out to employ and recruit 5 healthcare professionals, 2 doctors, 1 pharmacist, 1 nurse, 1 lab scientist in every state office of NHIS. And this can create, this will create employment, and this will creation of employment, which is in tandem with the President agenda, and it will improve the quality of services that we are rendering to our and it will eventually reduce the running cost of the national insurance community.
2 months after the recruitment process, the newly employed staff of the NHIS converged at the Asa Pyramid Hotel in Kaduna for an induction training. The training, which lasted for 2 weeks, had in attendance 190 newly employed staff who will at the end be posted to state offices of the NHIS. For each state office is expected to have 2 doctors, 1 pharmacist, 1 nurse and 1 laboratory scientist, making it a total of 5 medical professionals for each of the 38 NHIS state offices. The idea behind the recruitment and induction training for the new staff was to revive the NHIS as well as win the confidence of the general public, who the NHIS was created to serve.
This is very much part of the reform process, whereby the scheme will be professionalized, whereby the scheme will be able to act optimally, whereby the scheme will be able to serve to carry its mandate to the maximum, to the optimum, whereby the enrollees which we are serving will be able to get the requisite service. This is a set of professionals that are being inducted, that is doctors, pharmacists, lab scientists, nurses. So these are key to the implementation of the mandate of the scheme, especially at the state level.
A lot of change needs to come into the health insurance for us to be able to meet our mandates. And one of the things that we realized at the initial stage was the dire need for medical personnel in the scheme. And this is one of the laudable exercises that the Executive Secretary has taken up by employing the medical personnel. And the induction today is a good step in the right direction. A lot of us came into NHIS and had to group into the dark because we were not given this opportunity. This is the first time that is happening in the history of the scheme, and to me is a welcome development.
The Executive Secretary of the NHIS, Professor Muhammad Nasir Sambu, and other senior management staff of the agency were in attendance to ensure the success of the induction training. After giving a brief history of the NHIS to the inductees, Professor Sambu made it clear that the purpose of the induction was to refocus the thoughts of the inductees towards the new NHIS and what is expected of them in the course of discharging their duties.
What is the context? Why are we even employing you? Why is it that NHIS is employing only healthcare professionals? You need to understand the context very well. If you look at the functions of the National Insurance Scheme, the core activities that is undertaking, there is a lot of accreditation of healthcare facilities. There is a lot of monitoring for quality assurance. There is a need for effective referral system. There is a lot of reconciliation, financial reconciliation that is done based on the kind of sickness that has been treated by the healthcare professionals. If you don't have requisite healthcare professionals, how can these activities be undertaken?
Professor Sambu further stated that the recruitment was strictly for the purpose of getting professionals who will help make the NHIS what it is supposed to be.
We undertook this trouble in order to have good people within the National Insurance Scheme that can turn around the organization. And I believe that you are the people that will turn around this organization.
The Executive Secretary and other management staff of the NHIS, who were the resource persons at the induction training, lectured the inductees on various topics bordering on public health, healthcare system, healthcare financing, and health insurance. With the training done, the inductees are expected to be equipped and ready for the great assignment of achieving universal health coverage.
They are going to know the vision, they are going to know the mission, and it's good to start where you should start. Right from the beginning, we are talking of universal health coverage, we are talking of strategic purchasing, so people are going to get used to some new terms. There were clinicians, people working in hospitals, who are now being recruited to come and do a lot of public health system financing and all that, health system financing. And so there's a need to reorient their mind, which is what the ES has spoken eloquently about. The need for them to refocus their mind and to think population and not individuals this time.
The inductees were not only excited to be found worthy of this employment, but also grateful for being prepared for the task ahead.
They gave us the whole information, the full package. That's what they provided for us during this program. So I'm confident that we'll definitely execute our work.
I believe with this training program, induction program, I'll be able to be equipped with the basic principles. We'll be equipped with the basic information, the mode of operations to ensure my services are being delivered without deficiencies.
Now we are going to the field on a field experience. So we are ready to face it.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. On this episode, we chatted with Dr. Kolawole Owoka, the MD CEO United Healthcare Limited. United Healthcare is a health maintenance organization established since the year 2000. It has been working with the NHIS almost since its inception. Dr. Owoka speaks on some of the things they do as HMO to help NHIS achieve its objectives. He also speaks on what other partners can do.
We help in information dissemination because people need to be sensitized, and we do advocacy visits to different bodies so that they can know about the health. And to cover the whole country is simple. Federal government has started with the federal civil servants. Let every state governor also start with the state civil servants. Let every local government chairman also start with the staff there. And then when the states take over, they can also now start going into the informal sector, that is the market woman in their different states.
Dr. Owoka also shed light on one area of challenge that HMOs face with healthcare providers that can put a strain on their relationship.
Where we have problems are the fee-for-service, and those are the referral cases. Those referral cases, NHIS has also itemized an amount of money for it. But you see, our providers are already used to this: see your patient, write the treatment, and dictate the money. So for them now to be put under a system, a structure that limits the bill, they say, no, you can't limit my bill. This is what I saw when I treated my patient. No, this is a scheme, and these are how it works. So those are the things that causes a doctor, an HMO will vet the bill, And then the provider will say, no, we'll be appealing to the NHIS. And then some say they are owing me. No. It's not that somebody gives somebody money and it's not paid. No. We are private sector. We can sue and be sued. So we know what we do. Capitation is what they must be paid 100% as NHIS does. But fee for service, we have to vet it reasonably, because we believe that the treatment should be moderate and the treatment should be appropriate.
While explaining that relationships are constantly being improved between the healthcare providers and HMOs, Owoka calls on enrollees to always call on their HMOs for prompt attention, as this can make the scheme serve them better.
Yes, the enrollee, they should regard us as their best friend. A friend in need is a friend indeed. So if an enrollee has any problem, they should come to us. Our doors are open. If an enrollee gets so, maybe you have been to work since morning and you are tired, and your wife complains that the child has anything, just call the call center. They are manned by doctors and nurses. So you may not even need to come. If you can discuss with them properly, they will assuage your feelings and tell you what you need to do. And if it is compulsory for you to come, they will also tell you what to do. And as I told you, even if you are not in your location, you are in any part of the country, just the same, we have branches all over, so we can attend to you.
With the NHIS, the HMO is the enrollee's best friend. So call your HMO today and have that issue resolved. Coming up next is your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: are children covered under NHIS?
If you look at the way the NHI is structured, what we call the formal sector program, the public sector program, if a principal who is like the worker gets enrolled, who's the spouse, the children biological children under that principal, 4 of them under the age of 18 years, covered under the program until they get to the age of 18, when they can now join other programs to continue.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
On this note, we draw the curtains on this episode of the program. Join us again, same time, same station on another episode as we continue to bring you more stories of happenings around the NHIS. You can also watch the program on our social media handles showing on your screen. See you next week.
Service of the NTA.
Baby, truly, in your arms is the key to my heart. Please believe me completely.
This board is getting crowded. Yes. You know what to do.
He came to my house the other day, and I tried to, get to know him better and start a conversation. I got to realize that he and his biological sister had a terrible breakup.
What? Are you serious? That is incest. How on earth?
Well, everybody makes mistakes. And theirs was an innocent one. By the time he knew what really happened, it had already happened.
Ooh la la. That is so shocking.
Very. Poor guy.
I'm sorry for him.
Oh, too bad. He just needs to forgive himself and move on, innit? It has happened. He can take it back.
Oh. So funny.
It was just there on my doorstep.
You just saw it lying down there.
Yep.
But do you have any clue of whoever dropped it?
No. And besides, what does it matter? Look, see, we finally have concrete evidence to lock Maxwell Adesanya away for years.
So when are you going to turn this in?
Not yet. I have to wait for the perfect time